9:45, welcome back to Morning Break. We are tackling an important question for families this morning. When do you take your kids to the dentist? Dr. Leigh Wilson is here with Charlotte Pediatric Dentistry. Good morning.
Good morning, you guys.
Thanks for coming in. You guys are kind of all over the place. You have 5 locations, so
Yes.
people can find you north and south.
Everywhere.
Well, let's start with that question. What is the right age?
So the American Academy of Pediatric Dentistry says that you should have your child at the dentist within 6 months of the eruption of the first tooth, or by age 1.
And why is it important to get them in there at that early stage?
Totally. So it's not so much because we're seeing cavities by age 1. It's more so to educate the parents on, number 1, what causes cavities. Number 2, establishing a dental home. So where are you going to take your child when they get an injury, when they fall at daycare and get a toy to the mouth, things like that. And just really making sure that parents understand everything they need to be doing to take care of their children's teeth.
That surprises me because we took our kids when they started kindergarten. So that's when we first took them, but up to what, 6 months or to a year?
So usually the teeth come in starting around 4 to 6 months. So within 6 months of that is somewhere in between 10 months to a year old.
So you said establishing that dental home, and I think that's, from what I hear from parents, I mean, it is hard to get into the dentist that you want to get into, so it is important to start early.
It is very important to start early. You know, we can look at, are your children's teeth coming in the right order? Do they have the right number of teeth? And really be able to guide parents on some of the habits that we don't think are bad for our child, like juice all day or milk at night to sleep. Things like that we're seeing are really causing an increase in cavities at a really young age.
Is there also that chance to pick up on something that may not be coming in right or something that may be happening in their mouth that if you wait, you're dealing with a bigger issue rather than checking it early?
Absolutely. There are, you know, genetic defects in the teeth that can be inherited from the parents that if we see at that age, we can really stress prevention and intervening at an earlier age so that they don't develop really bad cavities.
So I get scared going to the dentist. I mean, and I'm not, you
already know how I
2,
would
3,
be.
4, 5 years old.
Right.
What's the conversation that parents should have with their kids before that first trip to the dentist if they're old enough to sort of understand where they're going?
Right. I tell parents the less you prepare them, the better, actually. So,
Yeah, that's good.
you know, they send us to 2 extra years of school to become a pediatric dentist to be able to call things like this, you know, Mr. Thirsty, and this is our tooth tickler, and, you know, things that are really kid-friendly. So really, the less you prepare them, the better, and the more fun they're able to have with us when they get there.
I wish my dentist called them those things. I'd feel so much better. We have about 30 seconds left, but what is the advice for brushing teeth for parents? You know, especially a fun toothbrush. That's a hilarious toothbrush.
So this is actually an infant toothbrush. You just slip it on your finger and just wipe the gums off with it.
Very tender.
Yes, very tender. It's actually called a tender.
Oh, nice.
And then this little toothbrush, you know, it's really small for a child's teeth, and you just, you know, brush their teeth to the best of your ability
And it should
twice
be soft,
a day.
not medium or hard.
Yes.
Right.
Yes, totally. So twice a day, brush their teeth every day.
All right. Dr. Wilson, thank you very much.
Thank you, guys.
Hopefully some helpful information. You still have time to weigh in, though. Let us know on Twitter at MorningBreakCLT when you started taking your kids to the dentist. We'll be right back after this.